everyone, welcome back to Sowkya Med Vision. Today we are going to discuss the wrist joint. In the previous class we have completed the elbow joint. Now today we are going to discuss the wrist joint. As the wrist joint is anatomically is known as radiocarpal joint. Yes, its anatomical name is radiocarpal joint. Why? It is a joint that is going to articulate between radius, lower end of the radius and the proximal row of carpal bones. Hence it is known as radiocarpal joint. So which type of joint it is? It is a ellipsoid variety. It is a ellipsoid variety of synovial joint that formed between lower end of the radius and the carpus. Carpus is the carpal bones, mainly the proximal row of carpal bones. So what are the articular surfaces? The articular surfaces are proximally the inferior surface of the lower end of the radius and inferior surface of triangular articular disc of inferior radio-ulnar joint. So inferior surface of the lower end of the radius. The lower end of the radius containing 5 surfaces. Yes, so the inferior surface of the lower end of the radius along with a triangular articular disc of inferior radio-ulnar joint. So there are two radio-ulnar joint. One is superior, one is the inferior. So here the inferior radio-ulnar joint is going to perform in the formation of wrist joint. Yes. So the proximal articular surfaces are lower end of the radius and triangular disc of inferior radio-ulnar joint. And the distal articular surfaces are proximal surface of scaphoid, lunate and triquetrum. Yes, these are the proximal row of carpus, proximal row of carpal bones. So what are the proximally presented? The radius, lower end of the radius and ligament, a disc, articular disc of inferior radio-ulnar joint. So and the distally, the proximal surface of scaphoid, lunate and the triquetrum. Yes, these are the articular surfaces that are going to form wrist joint. Yes, what are the ligaments? What are the main ligaments that are going to form around the wrist joint to make the wrist joint strengthen? There are 6 ligaments. There are 6 main ligaments of the wrist joint, starting with capsular ligament. Yes, capsular ligament, it is extended above. It is extended from above distal end of radius and ulna. It is extended above from distal end of radius and ulna. It is extended below from proximal row of carpal bones. It is extended from above distal ends of radius and ulna to below proximal row of carpal bones. Yes, the capsular ligament is inner side lined by any joint containing capsular ligament, inner side is lined by synovial membrane. So here also the capsular membrane from inner side is lined by synovial membrane. So now the next ligament is radiocollateral ligament that extends from the tip of styloid process. Yes, the tip of styloid process of radius at lateral aspect of the scaphoid and trapezium. See, it is extending from the tip of styloid process of the radius to the lateral aspect of scaphoid and trapezium. Yes, here you can see in the diagram, this is the tip of this is the tip of the radius. Yes, this is the tip of the radius and this is the scaphoid and this is the trapezium. So the radius is the radiocollateral ligament is extending from the tip of styloid process to the lateral aspect of scaphoid and the trapezium. So it is known as radiocollateral ligament. Yes, it is a radiocollateral ligament that is extending from the tip of the radius, that is styloid process, to the lateral aspect of scaphoid and the trapezium. Now the third ligament is ulnar collateral ligament. The ulnar collateral ligament. From where it is extending? Yes, it is extending from the tip of styloid process of ulna. Yes, it is extending from tip of styloid process of ulna to medial aspect of triquetral and pisiform bones. It is extending from styloid process of ulna. The process extending at the lower end of the bones is known as styloid process. This is a styloid process of the ulna. So the ligament, it is extending from the tip of styloid process of ulna to the triquetral and the pisiform. Yes, the triquetral and pisiform bone. It is known as ulnar collateral ligament. So the fourth one is palmar radiocarpal ligament. Yes, the palmar radiocarpal ligament. What it is? It is extending from anterior margin of lower end of radius, anterior margin of lower end of the radius to anterior surface of the scaphoid, lunate and triquetral. It is extending between anterior margin of lower end of the radius to the anterior surface of scaphoid, lunate and triquetral. These are the proximal carpal bones. Yes. Now, the fifth ligament is palmar ulnocapillary ligament. Palmar ulnocapillary ligament. Here it is extending from the radius to the proximal bones of carpal bones, right? Here it is extending from base of styloid process of the ulna. Base of styloid process of ulna to anterior surface of the lunate and triquetral. Here it is palmar radiocarpal ligament. Here that ligament is extending from the lower end of the radius to the scaphoid, lunate, triquetral. Here, whereas palmar ulnocarpal ligament is extending from the base of styloid process of ulna to anterior surface of lunate and triquetral. In palmar radiocarpal ligament, it is including scaphoid also. Yes, the sixth ligament is what? Dorso-radiocarpal ligament. Dorso-radiocarpal ligament. It is extending from posterior margin of lower end of the radius. In the palmar ligament, it is extending from anterior margin, right? Here, dorsal means backside, posterior, right? So, it is extending from posterior margin of lower end of radius to dorsal surface of the scaphoid, lunate and triquetral bones. Yes, just a word anterior and posterior is changing, remaining is same. And let's see the relations of wrist joint. Anteriorly, flexor digitorum profundus and flexor pollicis longus, median nerve. These are the main tendons and nerves that are present anterior to the wrist joint. Yes, flexor digitorum profundus, flexor digitorum superficialis, flexor pollicis longus and median nerve. These are the main that are present anterior to the wrist joint. Apart from that, they are also related to tendon of flexor carpi radialis and synovial bursa, the associated synovial bursa. Yes, here as I said, the flexor digitorum superficialis and flexor digitorum profundus, they are present along with their associated bursa known as ulnar bursa, whereas flexor pollicis longus is associatedly presented with radial bursa. Here the tendon of flexor carpi radialis is associatedly presented with synovial bursa, and along with them ulnar nerve and its vessels are also anteriorly related to the wrist joint. So now posteriorly how it is related? It is related to extensor tendons of wrist and fingers. These are presented posteriorly. And anterior interosseous artery. Yes. And posterior interosseous nerve. What is a posterior interosseous nerve? It is a branch of radial nerve. We will discuss each major nerve in the next lecture. So the posterior aspect of wrist joint is related to extensor tendon of wrist joint, fingers, anterior interosseous artery and posterior interosseous nerve. And what are the movements? Let's see what are the movements. The main movements of the wrist joint is flexion, extension, abduction, adduction and circumduction. What are the main movements? Flexion, extension, abduction, adduction and circumduction. Yes, this is the wrist joint. Once again, it is an ellipsoid type of synovial joint. The proximal articular surfaces are inferior surface of the radius, lower end of the radius and ulna. Distal are scaphoid, lunate and triquetrum. The two proximal surface. These are proximal surface carpal bones. What are the main ligaments? They are capsular ligament, inner side lined by synovial membrane, and radio collateral ligament extending from tip of styloid process to lateral aspect of scaphoid and trapezium. And the third ligament is ulnar ligament, and the fourth one is palmar radiocollateral ligament. Next, palmar ulnar-carpal ligament, dorso-radiocarpal ligament. The relations of wrist joint is very important. Anteriorly, what it is related to, and posteriorly how it is related to, and the movements. Yes, this is complete discussion of wrist joint. If you have any doubt, please comment in the comment section. Please subscribe the channel. Thank you.